and welcome to Quality of Life Radio, hosted by Lisa and Nancy, editors of BigBlendMagazine.com.
The gong has spoken. It is time to talk about heart health, especially during the coronavirus pandemic that is going on. We have Dr. Jackie Eubany back on the show today. Dr. Jackie's on our shows all the time. We love having her to share her expertise and good advice. She's a board-certified cardiologist and electrophysiologist, and also the author of the best-selling book, Women and Heart Disease, The Real Story. Of course, you can get on Amazon, all those great places, but you can also go to her website, womenandheartdiseasebook.com. You can listen to her past interviews and also articles by going to blendradioandtv.com. And if you are in Orange County, you can also visit her maybe through telehealth now. You might want to do it over video or over phone. You can connect with her at Cardiovascular Wellness Institute of OC, and she's got 2 offices in Orange County. And you can go to her website for that is cvwellnessinstitute.com. So welcome back, Dr. Jackie. How are you doing?
I'm doing well. Thanks for having me.
Now, are you wearing a mask? I feel like Zorro.
Of course. I wear a mask all the time. Yes. It's very important to wear masks.
I think Zorro knew that we needed, he knew about this pandemic. Nancy, I think you need a Zorro mask.
Well, I think it's fun that if I can have a cape with it.
Yeah, right? It'd be fun if everybody wants a cape. So, Dr. Jackie, this pandemic, it's been going. I mean, we started talking with you about this in March, talking about precautions, and of course, precautions have gotten tighter and tighter and more. And you were just on KTLA in LA talking about how the COVID virus also affects our different organs. So but before we get into that, are we seeing the light at the end of the tunnel of this? Do you think things will get better or worse sooner than later, I should say?
I think we do have some optimistic data. I've been following the data about new cases and the number of new cases daily and the number of deaths daily off of the Johns Hopkins website. And the outlook is optimistic. It is showing that the number of new cases of COVID is slightly decreasing, very slowly, but it is slightly decreasing. Also, the number of deaths daily is also slightly decreasing. I think that's good news. It's an optimistic outlook. It shows us that what we've been doing has been effective, but we shouldn't let our guard down. Now is not the time to stop doing what we're doing. The social distancing, the wearing of the mask, the washing of your hands, the staying at home mandates. All these have really helped with, trying to level out this curve. We keep talking about flattening the curve. I think it's working, but I still think that we're not quite ready to let our guard down because there's always this fear of resurgence of this virus.
Okay. So, and the flattening of the curve, it's been difficult because everybody's close to their refrigerators. I'm just saying, no, I think it is getting better, in some ways. And I think that, they're saying that it may come back, right? So maybe we just kind of, whenever we're out, try to keep that 6 feet distance and wear a mask when we're in like a heavily trafficked area.
Yeah, it's very important to continue these measures because these measures have been the reason that the numbers are looking better. So we're going to have a new world. This is going to change the way we do things from now on. But I think it's important that we continue to do this because, as you know, this is a very deadly virus. It is extremely contagious, and we really have to contain it by continuing these measures.
Do we know that, like, some of the household things that we use to disinfect our counters and our kitchens and such, do they work, do you think? I mean,
yeah.
okay.
Go ahead. I'm sorry. Finish your question.
Well, I was going to say, because, sometimes it's like, let's buy, I don't want to use brand names, but some antibacterial, or shall we be using good old-fashioned Clorox and bleach?
I think the disinfectants and the antimicrobials, or like the antibacterials, are effective in killing the virus, because we know this virus is very contagious because it lives for longer periods of time on surfaces than the regular flu virus. So if somebody with this infection comes and touches something, the virus can remain alive on that surface for many hours. So anybody who comes through that surface and touches it have a high chance of getting infected with the virus. So we know that the disinfectants, the bleach, can kill the virus. So it's very important, to also make sure you're cleaning your, surfaces with these bleaches and disinfectants to ensure that you're killing the virus, so that it's not staying alive and you're not passing it on to other people.
Okay, this is good to hear. Yeah, and then the mask thing. We need to keep the masks. Does it matter what type of mask we wear?
At this point, we're saying it doesn't matter. The whole idea behind the mask is because we started to discover that there's this asymptomatic spread. There's so many people out there that have this virus, and they have no symptoms, and somehow they're transmitting it to other people. And the whole idea of the mask is, if you're asymptomatic, you don't know you have the virus. But if you do, put the mask on and you cover your mouth so that, when you talk and, spray a little bit of spit, or you cough or you sneeze, your chances of causing this infection to spread goes down. So it helps decrease, again, because of asymptomatic people who have absolutely no symptoms, who are going on about their business, but they're spreading this virus and they don't know that they're doing that.
Mm-hmm. So the mask itself, to be clear, it doesn't necessarily protect you from catching it, but it does protect it protects the other people, so that if you do have it, you wouldn't be spreading it. Or does the mask work both ways?
Absolutely correct.
Okay.
No, that's absolutely correct. It
okay.
prevents you, if you have it and you're asymptomatic, it prevents you from actually spreading it because the virus, of course, lives in the droplets. So when you talk, most of us talk, we spit. You don't notice these little droplets that are coming out of your mouth when you talk, and that potentially has virus in it in patients who are asymptomatic. So it definitely prevents you from spreading it. Because we're finding that a lot of the spread of this virus is from asymptomatic people. So we need to stop that as well.
Okay. So, gosh, do you think we're all going to end up having, some kind of drug to prevent this or to help someone? Because, the hospitals, I know, and we got to give a shout-out to, everybody in the health industry that has just been stepping up, and working such long hours. I know hospitals have been overwhelmed, just not even having the supplies, especially at the beginning of this. So it would be good if there was medication for it and, some kind of prevention, for the future.
Yeah, absolutely. Yeah, I agree with you. First of all, I want to give a shout out to all of my colleagues and friends who are on the front line, doctors, nurses, everyone in the hospital who are really in the front lines of this illness. It has not been easy. It's been really difficult, so we give them a shout out and we continue to pray for them. But yes, we definitely need a medication or vaccination to help us with this pandemic. There are lots of medications that have been studied, that are currently undergoing studies, and vaccines are, currently being studied as well, or they're trying to come up with a vaccine for this infection. But this morning, Dr. Fauci was on TV talking about the results of this new medication that's being studied. Well, it's not a new medication. It's actually been around, but now they're studying it for the COVID virus called remdesivir. And he sounded pretty optimistic about this experimental drug. So there's just been this one preliminary study that came out about the drug showing that it shortened the period in which patients had symptoms. So patients who took this medication had symptoms for 11 days compared to the typical 15 days of patients who did not have the symptoms. It also showed that there was a very slight decrease in mortality in the patients who took the medications compared to patients who didn't. So although there was a trend towards, lower mortality, it wasn't statistically significant. It means the difference was not big enough to say for sure that this medication was decreasing mortality. But it's, again, it's good news. It's good news that, we're doing studies on medications. We're starting to see some results that we like, but again, more studies need to be done on these medications to determine whether or not they will be helpful. So this medication is not going to cure the virus, but it might decrease the amount of days that you are sick. Maybe it could potentially decrease hospitalization, but we'll see. There's more to come. We will see, but it's definitely good news.
On the flip side, the sad news is we've seen that this virus, I remember when we first talked, even the mask thing wasn't as huge a deal, but now it is. Washing hands is more important than wearing gloves and all of that, but we've also seen that this, all of a sudden, boom, yes, this is an airborne virus. And viruses mutate and do things, and so now we've seen that there's you can get pulmonary thrombosis, and it can affect your different organs, right? So this is a little bit different than when we first started.
Yeah, absolutely. So this virus is very deadly. We're finding out, as we're seeing more and more patients, and people are doctors or people, hospital workers are documenting what they're noticing with the patients who come in with this virus, and it's a deadly virus. It's very severe. It affects almost every organ system in the body, and the patients who are in the ICU are sick. It affects your lungs, it affects your heart, it affects your kidneys, it affects your GI tract, it affects your liver, it causes blood clots, it can cause stroke. I mean, just multiple organs are involved in patients who are very sick, and that's what makes this virus very lethal. This is not your typical flu-type illness at all.
Wow. So all of this, when we talk about heart disease and heart health, we talk a lot on the show. Obviously, since your Women and Heart Disease is your book, we also talk about, and you wrote it for a reason, which is, this is the number one killer of women in the country, killing more women than breast cancer and lung cancer combined. And,
Absolutely.
you've taught us all how to cut back 80% in our lifestyle changes. We'll cut back that risk of 80%. But right now, I think everybody's, starting to learn how to cook again and stretch those pants out. I don't know if all of us can fit in our jeans anymore. And I hear that wine sales are on the move. I know that I'm helping, and I think the 4 to 5 ounce rule went out the window a little bit. Sometimes you start having wine at 11 instead of 4.
Hello.
So we're seeing people go, hey, I had my smoothie, and then I went for a jog. What that meant was at 10 a.m. I had a frozen margarita, and I fell down. So we're seeing that these lifestyle things are we're needing to maybe go back to this health thing a little bit more.
Yeah. So, that's something that we're nervous about. I sit on the board of the American Heart Association here in Orange County, and that's one of the things that we're talking about. The fact that, we might see some setbacks in all the progress we've made in terms of education and decreasing the rate of heart disease in this country because of this pandemic. For one thing, we've noticed that a lot of people aren't coming to the hospital. People who are having heart attacks and heart issues aren't coming to the hospital, I think because they're afraid of the virus. And two, people's healthy lifestyle has probably come to a halt, period of quarantine where the gym is closed and people aren't going to work, so all you do is sit at home and eat and drink. So we're anticipating that once we are off this quarantine, we might see some setback in all the work that we've done. But that's okay. We just really need to get this virus under control because the consequences of that is just really tremendous. and then we can get back on track with our heart-healthy lifestyle and increasing survival
Yeah.
in this country.
Well, I wanted to say too, I think it's, you go to a store, you're just eating what you can find. If there's no pasta, you may eat the Cheez-Its, or people are, maybe you are eating pasta, and I think everyone's in a different circumstance.
Depends on the area.
It depends on where you are.
Yeah.
It also depends on your income, because, sometimes maybe, you've been laid off, and that's the one thing that's changed the health of our globe, really, on a global level, and it's also changed the economy, which I do think that financial situations directly affect your heart health because of stress, things like that. So
I completely agree with that. And if most people are probably like me, that when we get stressed out, we eat. So that stress eating is probably going on quite a bit around this time. These are stressful times. These are unpredictable times, and it's we do expect that people will fall off of their regular routine and their regular heart health, routines, because it's just stressful, it's unpredictable, and that's just part of what going through a pandemic entails.
Okay. And then the other side, in regards to seeing your doctor, and really, if you do have heart disease, it's probably you've got to take even more precaution, right? And still make sure you stay in contact with your doctors?
Yeah, absolutely. So because of the pandemic, we've implemented what we call telehealth. Most clinics all across the United States are probably doing telehealth visits now. And telehealth is when you have office visits with your physician via either telephone or some kind of video conferencing. This way we can continue to maintain the social distancing that's necessary to flatten the curve. So that you can get a hold of your doctor or have office visits via telephone or video conferencing, so you don't have to go into the clinic if you are scared of catching the COVID virus. So you do have access to your physicians right now. So it's very important to make sure you keep your appointments via telehealth. And if you're having a lot of trouble, you need to make sure you're in contact with your doctor so you can get advice on what to do if you're having trouble, and not just stay home. Okay.
And then you keep up with everything. Keep up with your medications, to your blood pressure and all of that. And exercise, right? That's the one thing we can do. I'm just going to say as much as we can, right?
Yeah. Mm-hmm. Yes, I agree with everything you're saying. You need to make sure you're taking your medications on time. You try not to, try to get your medications refilled before you run out. If you have about a month's supply, you need to be letting your doctor's office know so that they can refill the medication. Continue exercising. I know that the gyms are closed, but you can always take a walk around your neighborhood and get some exercise in that way.
And wear a mask when you do that.
That's right.
And wear a mask.
Yeah, well, we're doing that. And walking, we're our 1 hour walk. Dr. Jackie sent us on that mission.
That's right.
To do our 1 hour walk. We've done quite a bit of it, even out here. We're having to get up at, early in the morning now because we're in the high desert today. And it's sunny. It's warming up. And so you just get up earlier and earlier. But it really does calm you down. And I think it's good for your body, for physically, but there's a calming thing about taking a walk, maybe going out in the gardening, things like that to calm down. One thing too, I know a lot of families are together, and we're looking at some of the symptoms of being like stroke coming from this, right? So can you tell everyone the difference between a heart attack and a stroke, what to watch out for? And it's going to be different for men and women, right?
Yeah. So first we talk about stroke. A stroke is when you have blockage in the blood vessels that supply the brain with oxygen and nutrients. Some of the signs of a stroke, we have this mnemonic called Be Fast that helps you identify whether or not you're having a stroke. And it stands for, F is for the facial droop. Your speech impaired, and weakness in your arms and your legs. And lastly, you should call 911 right away. Whereas a heart attack has to do, again, with blockages in the arteries in the heart. So the heart is deprived of all the oxygen and nutrients it needs to function normally, and you have parts of the heart dying, the tissue dying. And this can present with symptoms of chest pains and shortness of breath. And maybe radiation down the arm. And I know we've talked a lot about the differences in heart attacks between men and women, because women can have slightly more subtle symptoms. But again, you need to know what risk factors you have for heart disease, so that if you are having some, symptoms you just can't quite put your finger on, but you know that you're considered high risk for heart disease, that you should either be telling your physician about your symptoms, or you should, call, go to the emergency room for treatment.
Yeah. I think, because this can affect your heart, if it's affecting your organs, it's affecting your heart, right? At the end of the day.
Absolutely.
Everything leads back to your heart. So I do want to tell everybody, Women and Heart Disease, the book, The Real Story, really go get that, because it gives you all kinds of lifestyle tips. And I think it's for men and women to read, because men need to understand what their friends, their wives, their sisters are going through, especially with a heart attack. And Dr. Jackie does have articles and interviews about this also up on blendradioandtv.com. You can read her there. You'll see her in our expert department, or just type in heart health, and you'll see a lot of different interviews with Dr. Jackie on there too. So always good information. Dr. Jackie, with all this craziness, are you able to get a chance to continue working on your book about the Mediterranean diet for heart health?
Yes, I'm working on it. It's coming along nicely but slowly, because things have been so busy, and everyone has had to pivot and change their lives around. But I'm working on it, and you will be seeing my book coming out soon.
Awesome.
Cool.
We're going to need it, you know. We're all going to need this one.
Yes,
we are.
That's right. After we're done with the pandemic, we need to get back on our heart-healthy lifestyle, for sure.
We've actually gone entire days without wine. I want you to know that. And I was like,
on you.
Well, because there's only so many times you can go to a store, right? It's such a big deal. And it's like, okay, is the wine that important? No. And then the next day, like, yes. But I'm sitting there. It's just like Christmas time, I always tell you, okay, Dr. Jackie's going to the store with me. She's sitting on my shoulder. Then you're the wine angel now. Now we're like, okay, no, Dr. Jackie would not let us have that third one. He's sitting there going, no wine for you tomorrow. So we'll start behaving again as we start traveling out again, Dr. Jackie. But I feel like we're going to have to move from walking to jogging. And I don't know.
That's right.
That's so scary. Everyone, again, Dr. Jackie's website is womenandheartdiseasebook.com. And if you're in Orange County, contact her at cvwellnessinstitute.com. Right before you go, Dr. Jackie, I did have a quick question on that. We always talk about people coming to see you in Orange County. But with this telehealth, do you see yourself doing more telehealth in the future once everything calms down with COVID-19?
Yeah, I think telehealth is a good idea, especially for, patients that you're following up with, patients you know pretty well. You're just following up with them, making sure that their blood pressure is okay, that they're taking their meds. I think that there is a role definitely for telehealth in that. So I will definitely expand my telehealth clinic.
Okay, nice. Very good. Very cool. All right. Well, we always love to play Nikki Chris's title track to our album. It's called Heartbeat. We have to. It's a good pairing for Dr. Jackie. They've been on shows together as well. And so here it is. We're going to play Heartbeat, and you can keep up with Nikki at NikkiKris.com, and that's NICKIKRIS.com. I just suddenly said, okay, did you do that right?
Wait for it.
I know. Wait for it and wait for it. It's coming. All right, here it is, Heartbeat. Take care, Dr. Jackie. Thank you for all you do.